I really appreciate all of you being here to really think about all the ways that you're impacting all the work that's needed out in our communities. And so before I turn it over to our panelists, what we want to do is really give you a few case scenarios of what it means to adapt and focus right now, given all the political and economic changes that are happening in our landscape. So with that, we want to first talk about two case scenarios and then really turn it over to you for Q&A so we can really have very concrete strategies for all of you to walk away with. So I will hand it over to our first panelist.
Yeah, good afternoon and delighted to be here. In my role, I get a chance to look across all that the American Heart Association, the American Stroke Association does. And so when you think about our mission of improving the health of all Americans, when you think about the importance of legislation, whether it's at the local level, the state level, or the federal level, that is a key component to everything we do. And when you think about funding related to those policies, it's essential that we continue to work with all forms of government to understand what is happening, what is potentially going to happen, and what will the adverse impact be to all of the people in the communities that we serve. And one of the biggest things we focus on, first and foremost, is trying to separate the difference between policy and politics. And if you unpack that a little bit, you know, the politics of things is what drives headlines, and it drives ratings, and it drives emotion. And you can argue that the last 10 months or so brought out some of the strongest emotion in our country and arguably around the world because of the politics of things. But what we're learning to do is really keep in mind what's our end game. And our end game is to focus on communities, to focus on people, and to know the difference between what someone says they're going to do versus the policies that are in place that might be jeopardized if things get changed. So an example of that is we've heard a lot of politics around the Affordable Care Act. We've heard a lot of the narrative around budget cuts. At the American Heart Association, American Stroke Association, we're spending time trying to make sure we understand what specifically is going to happen. And up till now, nothing has happened. And that's really important for you to know because the news cycles and everyone will spend a lot of time on the politics of things, but we're trying to listen. We are trying to make sure that we understand the pieces. And so whether it's health care for all, whether it's around preconditions, whether it's around meals in schools, whether it's around programs in communities to build infrastructure or education, or whether it's around livable wages, all of those things go into the health of all Americans. And so we're trying to become better students at listening to the politics, but keeping our focus on the policies, because the policies that are in place today are impacting millions of people, and we're thinking through the mitigations. If this changes, what will we do? If there are significant cuts in meals, what do we do with kids' programs in schools? If things change from an affordable care where it's no longer for everyone, what are the mitigation strategies? And we're trying to understand that, because until you understand it, you don't really know what it is you're trying to solve for.
No, absolutely. And I love that analogy because as a deputy mayor for Health and Human Services, the most frequently asked question is how I'm preparing and what I'm going to do. And my first response is, I don't know yet, because we don't know the true impact or the magnitude of impact. So to your point, I think the readiness is really important, but we don't know yet, right? The unknown. So with that, Eric, I love the theme between politics and policy. All of us actually on a day-to-day basis try to implement sound policies for impact. Can you talk a little bit about how your organization and the environmental movement have adjusted?
Yeah, thank you. So there's sort of a saying among the mayors we work with is there's no Democratic or Republican way to pick up the trash or to remove the snow. So I'll kind of start with C40's mission, which is really to help the mayors around the world collaborate on climate change policy. So we work with 91 megacities around the world to help them reduce greenhouse gas emissions and reduce climate risks. And the idea is cities around the world are really often trying to solve similar problems. And if you can allow them to collaborate, share best practices, share things that didn't work in a comfortable space, then we can accelerate positive happenings and keep mistakes from happening twice. And so the idea that really drives this, which I think plays into the idea of politics versus policy, is that our narrative has always been around that mayors act. And that if you really want to enact change, it's the perfect level of governance that's very close to its constituents. There's nowhere to go, there's nowhere to hide. If you don't have the snow picked up, they're coming after you with pitchforks. But there's also, if you can aggregate the impact of our 91 cities, it's 650 million urban citizens. It's about a quarter of the global GDP that makes its way through our metropolitan areas. And so you can actually take that collective impact of those mayors and then collaborate well with private sector, with state governments, with universities to create a very large impact without having to maybe get caught up in some of the political issues that can sometimes inhibit. So I think an example of how we've evolved the last few years, and how I think we'll continue to in the current environment, is to really take a step back and assess the more holistic benefits of climate action. Climate environmental causes tend to be a bit abstract, a little bit far-reaching. You know, if we look at the breakdown of the Class E100 environment as I think the fifth one on the list in terms of frequency, and I think that actually is true when it comes to things that people really on the ground are working through. And it's on the top of the list are health and human services, literacy, equity, poverty. And so what we've been able to do is really think about what are we after? It's improvement in quality of life, it's economic development, it's jobs. And so, for example, we've had a partnership with Novo Nordisk and Johnson & Johnson around the benefits of climate action and health in cities. There's a disproportionate occurrence of diabetes in the world cities. People who live in cities are more likely to suffer. And so if we think about the solutions that we advocate from a climate perspective on transit, mobility, walking, biking, those are things that actually have a massive relationship with health as well. And so kind of broadening our impact, thinking about our other benefits, we've really been able to collaborate. And I think we're going to see that happening more and more.
Great, that's very helpful. As you try to pivot during this time, can you both speak to kind of non-traditional partners that you have considered partnering with in your respective areas and content areas? Would you start with?
Yeah, thank you for that question. I would start by just going back to, Eric, what you were saying when he talked about climate and the other determinants of health. And it's important that you understand that when you talk about someone's health, unless you understand the journey, you can't really help them improve their health. Example, if you live in a community where transportation isn't good, the likelihood of people being healthy in that community is going to be smaller than a community that is healthier. When you think about education, if the education of the community isn't at a reasonable level, hence the health of that community. If you think about what we call determinants of health, which are all of those things, it forces you to take a broader view on what issues you're really trying to solve. And I'll give you a couple of examples. And so we've learned that you can't improve the health of a community unless you understand what's important to that community. So in many communities, crime is a big deal. Some communities have some of the prettiest parks in their city, but people are scared to go to the parks because of the crime. So unless you do something about the crime, they're not going to use those parks. There's also something to be said about infrastructure. There are a lot of people that would love to go to work or to school, but if transportation isn't right, it creates a different problem. What we've found ourselves pivoting towards is, instead of being primarily driven by science, and the American Heart Association is driven by science and evidence-based programs, we've learned that that has to influence what we do, but what we've learned is that we have to earn a seat at the table of the community. And so we've thought that we were responsible for all the answers. We thought we were responsible for all of the programs, the products and services, because we had all the science. And while that's really important, what we would do then is invite people to the meetings that we were having. What we've learned is that there are tremendous things being done in communities all around this country and around the world, and we had to earn a right to be invited to their table. So one big pivot for us is recognizing that as great as we are and as important as the work is we do, we say our work is priceless, but it's insufficient unless we do it with communities. And so one big pivot is earning the right to be invited to the community's table, because they're already doing wonderful things. And what they really need is someone to amplify those things. What they really need is someone to maybe aggregate that. Instead of benefiting 1,000 people, help me reach 100,000 people. And instead of us creating things, we're learning more to be an aggregator, a potential distributor, a honest broker, if you will, of wonderful things that are going on in communities around the country to solve an even bigger problem that a community has decided to fix on their own, but it's a macro thing that can be applied to other places.
Yep. I love that analogy because it's really top down and bottom up, that without the other, you really can't actually focus on some of our issues that we need to address. Eric, what are some non-traditional partners and surprise partners that you've had?
So I think to continue on Gerald's note, I think we use the phrase necessary but not sufficient often when it comes to the idea of cities reducing emissions to meet a climate safe pathway. So we produced research at the end of last year. It was our Deadline 2020 report, and it posed the question of what do cities' activities need to look like in order to meet the Paris Agreement, in order to maintain a 1.5 degree warming pathway. And one of the key elements that came out of that was that cities can impact about half of the emissions that are necessary to meet that pathway. So it's necessary if we're going to meet it, but it's not going to be sufficient. And of that half, cities really, they have autonomy over a certain number of things, tending to have higher autonomy over waste, maybe over buildings. But there are vast emissions generating portions of cities where there's very little autonomy. And that's where collaboration really comes into play. And the majority of the reduction actually has to come from that kind of, call it our collaborative governance typology. Maybe you can set a policy or a public statement or control the budget, but at the end of the day, if you're actually going to make progress on your energy supply, you're working with local utilities, you're working with the governor's office, you're working with the DOT. And so I think in some cases, it's from our city's perspective, it's less about working with non-traditional partners, because I think cities have always had a very collaborative mindset. A lot of it is about kind of realizing how quickly and how necessary collaboration has to be. From the perspective of C40 as an entity and as a nonprofit, we've recently launched a partnership with MasterCard, which might not make a huge amount of sense. Credit cards, payment, climate change. And they actually sponsor a network that we run on mobility management. And one of the big hurdles to emissions reduction is the transit sector. How do you get people out of cars? How do you get them walking, biking, taking public transit? And you have to do that in a way that makes it desirable. And you have to reduce the friction that exists within these systems if it comes to multimodal transit. And MasterCard is working with London on the Oyster system, contactless payments, trying to reduce that friction and get people out. So it's these partnerships where I'd say maybe 10 years ago, 5 years ago, if you were thinking about environmentalism, if you were thinking about climate change, those dots probably wouldn't have been connected. But given where we are, you're going to see a lot more of those partnerships happening. Yeah.
I love that story. As a former executive director of a small nonprofit, I was looked upon as being a little crazy for actually approaching big high-tech companies to partner with, like Amazon or even the White House. And for a nonprofit of 5, that was a very untraditional market or a target audience for us to partner with. So I love that push for us to think about something different. Now, for both of you, you are with big organizations. How, in this new climate, would you define success in your respective spaces? So let's start with the health side.
I think I started by saying the American Heart Association's goal is to improve the health of all Americans by 20%. And I mentioned along my talk is that we're a science and evidence-based organization. We can tell by community the health of a community. We can tell using our Life Simple 7 algorithm, which looks at things like blood pressure and glucose and physical activity, healthy diet. We can look at all of those things and determine the health of individuals, the health of communities, and we use that data as a beginning. We use that data in conjunction with other data sources like hospital system data, et cetera, to determine the health of a community. I will also tell you that as part of our work and other great organizations like Robert Wood Johnson and others, we've been able to determine that your zip code determines your life expectancy. And for those of you that have never heard that, and back to your question around how will you know if you're making progress, it's really clear. The data doesn't lie, the zip codes tell you. I'll give you a couple of examples. In the city of Chicago, on the Green Line, if you've ever written CTA, the Green Line, in a 5-stop difference, there's a 12-year life expectancy change. For those of you that are local here in Boston, I think there's a Back Bay neighborhood or something like that, pretty affluent, and then I think Roxbury's pretty close to that. There's an 18-year life expectancy difference because of the services and everything that goes on in that community. And so when you ask, how will we know we're going to be successful? We have the ability, with data that we have, in addition to the CDC's data, hospital systems data, to look at the health of communities at the zip code level. We also work with corporate partners so we can gauge the health of workforces. We also work with thousands of schools so we can gauge the health of schools. And so we have several metrics, being an evidence-based organization, to help us understand whether or not we're being effective. And the last thing I would say is that our policy agenda, both local, state, and federal, is significant because, for example, there are 8 million people, based on some of the policy work we've done, that has access to Medicaid expansion. So 8 million people that qualify for Medicaid expansion because of advocacy that would never have had a chance to get it. For example, there's 37 states working with local policy that have approved, in order to get a high school diploma, you have to get some kind of CPR training. So that's 37 states, 2.5 million high school students every year will not be able to get a high school diploma unless they get some form of CPR life-saving experience. And so when you say, how will we know how effective? It's our policy agenda, it's working with corporate partners, it's looking at zip code level data, it's working with CMS, it's working with hospital systems to really quantify the magnitude of the work that we do.
I love that. Eric, what about for you? How would you define success?
Yeah, so I think this is a lesson in making things tangible and immediate, because I'm about to talk about carbon emissions in 30 years, and my heart is racing about the injustice and the inequity and really the things that you guys are trying to tackle. And ultimately for us is we need to see global urban emissions coming down. For cities that are developed, they need to peak and start coming down. And for cities that are growing, that are going to see massive economic growth, going to see massive population growth, they need to peak sometime within the next 5 years and then begin to come down. So success for us is really, we're in a position now, over the last few years, we've worked with partners around the world, World Bank, ICLEI, support from Bloomberg Philanthropies, to come up with a global emissions standard for cities. 5 years ago, there was really no good mechanism to look at Rio's greenhouse gas emissions versus Beijing's, versus Sydney's, versus New York's. Apples to oranges. Now we've got a standard. Cities are reporting to that by commitments to global initiatives like the Global Covenant of Mayors. Over 7,400 cities around the world have committed to providing emissions, setting targets and setting plans. Then we have a reduction in climate risks, and it's a similar story. 5 years ago, the way Boston might describe a heat wave would be different than the way that Chennai would describe a heat wave. And so now everybody's speaking the same language, and now we have that data, and we can begin to facilitate collaboration in a kind of a much more accelerated way. And so as we see in the long term, we see cities reporting that those risks are coming down, they're being managed, and that the emissions are coming down. And in the short term, there are just things that we know need to happen if we're going to see that reduction. We know that mode share has to shift from private cars to public transit, walking, biking, and that existing private vehicles need to become electrified and grids need to clean up. We know that buildings need to become more energy efficient. You can't walk through a city like Boston or New York in the middle of winter and see windows open anymore. It's unsustainable, it can't happen. And so for us, there's that long-term target, but we know that we've really got to see movement on these shorter-term issues coming up.
Great. So we've talked a little bit about pivoting, but what about messaging? What are changes in messaging in terms of the topics that you are both focused on and how you have changed. So this isn't my first transition. During the Clinton-Bush transition, I was working with in the prenatal health space. And quickly we had to shift from working on preventing infant mortality to family planning. So it was a very intentional way of focusing on the work, but actually being very intentional about the messaging so that we could embrace more of the community that we needed to work with. But I wanted to just ask both of you, is there very concrete messages that you've had to shift? Eric, do you want to get?
Yeah, so I'd say the concreteness of the message is, to sort of back to the idea of going back to basics, is, you know, climate, we care about climate because climate stability is what's enabled civilization to develop in the way that we know it. That's allowed economic development, allowed prosperity, allowed cities to stay in the same place and develop agriculture and develop, you know, thousands of years of history. And so if you look at it from that lens, climate becomes less of this kind of ethereal, abstract, long-term item to the messaging of, you know, if you, one of our core donors is an organization out of the UK called the Children's Investment Fund Foundation. And their mission is to create a safe world for children. And you can't create a safe world for children if there's climate instability. And so I think there's, you know, a number, we've instituted an inclusive climate action initiative, which is all around getting into better touch with communities and connecting with them around the day-to-day benefits of climate action. And so I think the messaging has become a lot more holistic. It has become connecting kind of this longer term vision to the day-to-day activities that really, you know, ultimately, you know, it's tough to motivate for something that's so far in advance. It's never going to be the thing that's beating on the door as quickly as safety, as health, as equity. And so it's really been about understanding how we can kind of meet people where they are in terms of what they really care about, what they're talking about, meet funders where they are, meet mayors, meet constituents, and really figure out the strong linkages between the climate actions that we are advocating for and those benefits.
Yeah, I think he's headed in the right place. And I would just say, you know, messaging also depends on who. And so when you think about the complexity of health, you know, there's the scientific community, and that narrative is always going to be around the best science solving the biggest issues. And how can we accelerate it? Because the one notion about research is that it takes a long time. And we are a right now culture. And so how can you find creative ways to accelerate phenomenal research? So that's one narrative, right? For the medical community, how can we talk about systems of care? And what does that really mean? And equitable care. So no matter where you live, the hospital you go into, you should be able to get the same kinds of services. It shouldn't matter about the zip code. And then for the primary care physician, talking about the importance of using a phrase that you have, and it's actually one of our guiding values, meeting people where they are, right? So bedside manners for a primary care physician is pretty important. And yet some primary care physicians may not think about how they have to evolve the way they administer care to their patients. But patients don't look forward to going to see some of the doctors because there's a relationship that may not be as strong as it needs to be. And then so for corporate partners, you know, they have a business to run. So our narrative with them is really around, we share a consumer in mind. So whether it's women, whether it's kids, whether it's families, whether it's millennials, let us talk about the business issues that you have and how can we talk together to solve your problems. And then for the communities themselves, it's actually, and you heard me say this at the beginning, we have to earn our seat at the community table. And what we really want to do is find ways to force people to lean in. And so narrative that pushes people away or narrative that makes people defensive isn't really what we want to do. So an example is, you know, health justice may want you to become more inquisitive as opposed to let's talk about the problems in health in a certain city. Well, by talking about the problems of health, that headline may not endear more people to want to lean in. It may push people back because people say, oh, I've already heard that already. But if you said, I'd really like to bring 1,000 people together to talk about health justice and or health equity, you might get more people who want to come in. One, because they're curious, and two, it doesn't strike some of the things that have already put people on defensive. And so our messaging, depending on the audience, has pivoted. But I would also say that our guiding values force us to meet people where they are, so education comes into it, right? We also want to speak with a trustworthy voice. And so, again, science is always going to be one of our cornerstones, but what we've learned even with science, and I'll give you a very specific example, for years we have said heart disease is the #1 killer of women. And that is a fact. And I'm sure most of you, if not all of you, know that. But in some recent work we were doing with our ad agencies and our creative strategies, what we realized was that didn't really resonate with women or men or brothers and sisters as much as heart disease is the #1 killer of moms. Think about that. So on the one hand, science-based heart disease is the #1 killer of women. That is true. And many people that resonated with them. But when we started thinking about different ways of saying it, heart disease is the #1 killer in moms, that landed differently with a lot of people. And so depending on who, depending on what, the need to be intentional will be driven by those things and our guiding values, like meeting people where they are, speaking with a trustworthy voice, or inspiring passionate commitment.
Well, your example of the difference between girls and moms, it just again goes to how personalized this work is for so many. We talked before we came together as this panel, and one of the things I wanted to leave all of you is just the sense of optimism during this very challenging time for a lot of us. And as a civil servant now, I'm thinking every day about how to, think about a reserve, how to work with philanthropic partners to really think creatively about how to help all of the providers. So one of the questions I had is, has your conversations with the philanthropy landscape changed at all? I know in the District of Columbia, before the election transition happened, many of the funders came together to ask nonprofits, what is our role? How do we respond? How do we collect and conserve and get ready for the worst case scenario? So a lot of the kind of strategic planning from, again, non-traditional partners is happening outside of our spaces. So I wonder, as you both are in the space of fundraising and marketing your work, how has that conversation changed with funders in particular?
Yeah, I'll start that one. I think some of the things remain tried and true. So funders want to do something significant that makes things better. And so at the core of that is we've had to work really hard to magnify the opportunities and then quantify the upside if we had additional resources. So right now there's 24.5 million people that live in food deserts. Don't know how many of you know that, but within a 3, 4, 5 mile radius, the access to affordable fruit and vegetables, you can't get to it. You can get to fast food places, you can get to other non-healthy things, but there's 24.5 million people that live in food deserts. And so when you're talking through to the philanthropy community, whether it be organizations or individuals, they care about that. And if you can bring that to life for them, they care about that. And if you can bring it to life in the communities that they care about. So some of the investment community only cares about the communities that are important to them, where they grew up, where their families are, those kinds of things. And there's nothing wrong with that. And then there's those that care about helping people all over the place. In fact, one of the things we've learned is that most of the philanthropy comes from very affluent communities, and the money is spent in other neighborhoods that may not be as affluent. And so there's a big heart of philanthropy out there, but the ability to dramatize the need, to really dramatize the potential if there was significant investment, and to really be able to measure, back to evidence-based, the outcome that comes with it is significantly important. And then I think the last thing to remember is that the community can be its own source of revenue. And so, this past election showed you that people are willing to spend $1, $2, and $5 at a time on issues that they support. And I think Bernie Sanders was able to raise $54 million going at that approach. So communities want to be a part of the solution. Churches want to be a part of the solution. So talking to churches about their communities, working with schools and using the young kids to fundraise, it's been tremendous. And then talking to the wealthiest people in the country, because they all want to leave a legacy. So once you've achieved some level of success and your family is good and your immediate circle is good, they then want to also talk about how can I make a difference as big as I can, and the word legacy, creating a legacy for my family, comes up. And so the more you can help someone understand that they can help improve a community or communities plural by investing in something significant, those are things that we're continuing to do more of. But more importantly is listening to what's important to the funder. Because typically they know what they want to fund. They want someone that has the efficacy, the know-how, or the ability to convene others that can get it done.
Great, that's a great example. What about for you, Eric?
Yeah, for us, a lot of the conversation is around scaling impact globally outside of our network. So, we touch a lot of lives with our members. It's 91 cities, 48 countries, 650 million residents. Even if every C40 city was carbon neutral tomorrow, it wouldn't be enough. We need to make sure that when great things happen in our cities, or when great things happen in non-member cities, we can be a really effective mechanism for accelerating that and for helping it grow. So what we've seen over the last 5 years is, if I say bus rapid transit, does anybody, show of hands, does that ring a bell for anybody? I have one head nod. All right. They brand it very different ways. New York City has one, they call it the SBS. It's this brilliant solution that came out of Curitiba, Brazil. And it was really born out of a necessity to create good public transit with limited budget and limited infrastructure. And the idea was, we don't have enough money for below ground or above ground rail, but we know we need to take the benefits. So they ended up sequestering a piece of existing highway infrastructure and more or less turning it into a light rail system, but using existing buses and using existing roads. And we've seen that solution more than double in the last 5 years. And that's a really, a case where we've got a great solution coming from the global south. Really, necessity is the mother of invention, and making its way all around the world. And so we have to continue to accelerate those things. And that's really, to your point, funders want impact, and they want to see that their money is being spent well. And if we can impact 90 cities, that's incredible. But if we can impact, 500 cities, 1,000 cities, 10,000 cities that really need to solve this global problem, then we're in really kind of the strongest position.
That's great. I want to turn it over for some Q&A, because I know that you probably have a lot of questions for both of them, and I am certainly mindful of some of the themes that are percolating, but I also want to make sure that the audience gets some time with our resident experts. So why don't we queue up a couple questions? I see a couple hands back there. Thank you for managing the heat.
That was a fan.
Hi, thank you very much for this discussion. This is Meredith from Universities Allied for Essential Medicine. I just have a question around corporate partnerships. And I'm curious to know what sort of mechanisms you have in place to make sure that the corporations you're partnering are not actually complicit in other injustices against the people that we are trying to provide services for.
You strike a really great question. And in our organization, and I think most nonprofits, we have corporate relations governance. We have corporate relations policies. We typically try to work with companies that are trying to be a part of the solution. For example, we will not work with tobacco organizations. And I say that because of a lot of the advocacy and so on that we work with. When it comes to other consumer industries, we're sitting at the table with many of them because some of them have a portfolio that all of the portfolio may not be as healthy, but some of it is. And so one of the questions is, are you willing to partner with us to improve the health of your menu over time? And so we're working with nutritionists, we're working with their food scientists to evolve the percentage of the menu, for example, where food is as an example, to get it better. We're working voluntarily with the food industry around sodium reduction. So, and what's interesting about sodium with consumers is the moment you tell them that you've reduced it, they don't want to eat it. And so there's this fine line between, and I think it was in the salty snacks business several years ago, I think one of the companies took salt or sodium out of their chips and so on, and they advertised it, and they seen some of the biggest drop in sales because they did it. What we are learning is that some consumers don't want to know, they just want you to do it and don't want to know, but our point has always been, how can we partner with like-minded organizations? How can we stay true to our guidelines? And how can we, if we don't meet in the middle on things, how can we, instead of saying no, how can we be a part of maybe moving them further towards the good or to the better? And we spend a lot of time doing that. But we 100% will not work with the tobacco industry. And we have corporate policy to govern a lot of other industries as well.
And one example I could give is a few years back, the network of women's foundations were all struggling because there was a corporation who wanted to partner with all of them, and a handful of them decided not to. But I think back to your point, they all had very different principles that guided their work and their decisions. But really, I think it really is a very nuanced conversation within your organizations for sure. Any other questions? Oh, yep, we see. Oh. That's a tough.
Hi, you probably knew this one was coming,
yes.
But I am very curious to hear about how your organizations are going to approach what is now obvious hostility on the part of the current administration in Washington to the ACA and the withdrawal of the Paris Agreement. Is the American Heart Association prepared to take a position in opposition to the ACHA, and is your organization going to activate to keep us at the table for climate change globally?
Yeah, so the good news is that your question has already been answered. Our CEO, Nancy Brown, in conjunction with a bunch of other national leaders, has publicly written letters to Congress and to the President around the importance of care for all. We are adamant believers that affordable care for all is essential to improving the health of all. And so our letters, our social, our advocacy will continue to offer up nonpartisan solutions to ensure that the health of all Americans is preserved, and publicly stated by a Huffington Post, publicly stated by social media and so on. That is what we're doing. We're taking a stand because we believe that it should be affordable, it should be accessible, and it should be easy to understand. And we're going to continue to drive that message home because we believe in it.
Directly in the aftermath of the announcement, acting as Secretary of Cities and Climate Change to the UN, Michael Bloomberg, former chair of C40, was with the mayor of Paris and President Macron to announce an initiative around We're Still In. So Anne Hidalgo, the mayor of Paris, is chair of C40, really kind of sets the agenda and is obviously quite significant given the city that she represents. And all 12 C40 mayors in the United States, we have 12 domestic cities, including Mayor Bowser of Washington, D.C., and Mayor Walsh of Boston, have signed on to this agreement along with 1,200 other actors from academia, the private sector, governors, and other mayors. And the title kind of says it, we're still in. The majority of our cities have long-term climate action targets and plans to set 80% reduction by 2050, carbon neutrality by 2025, 70% by 2030. And so there's a very clear voice that says we've always believed that this change is going to be driven by this coalition, by mayors, and we're going to continue on that pathway. Yeah.
And for us, we were one of the first cities to come out very publicly to be a sanctuary city. So the mayor and I are very committed to that. And what's hard is, again, as noted earlier, we don't know what to expect, right? There's still so much unknown, but the principles behind being a sanctuary city, we're behind all the way. Any other questions? Oh, there's a few more. Yeah. Oh, one more.
Hi guys. Sorry. My name is Alex. I work with a company called General Assembly. I'm curious, I see that between you guys, I think the reason that you guys are also so effective in your messaging is the data that you're putting behind it. I'm curious, with an organization like ours where we're focused on reskilling the workforce in tech, data, business, if there's an opportunity or a need for companies like ours to support nonprofits in the change with the policies and the rhetoric, like how we can empower them with data and technology to be more effective.
Yeah, I'll start with that one. I think the short answer is yes. I think we need partners from technology companies to help us. So we're working with a wonderful software company called Click to help bring our data to the public, to tell that story. Because we know scalability is very dependent on, technology is a massive part of scalability for us. So if we want to tell our story well, if we want access to climate solutions, good climate data, we need that technology. So I think there's absolutely a key partnership there. And I can let Gerald speak on the HA.
Agree 1,000%. And one of the challenges we have in this space is that there are so many sources of data. And there are so many different data points that might impact the health of an individual or a community or a corporation, and the ability to create platforms that talk to each other. One, I think the ability to be able to answer questions. One of the things I'm fascinated by is the IBM Watson concept, and the ability to aggregate reams and reams of data faster to get faster answers. And so we don't have a data shortage, we have an intelligence shortage. And so to the extent that your model can help decipher the reams of traffic jamming stuff, to the degree that your model can help answer complex questions, to the degree that your model can help people understand the progress that they've made, and more importantly, if you invested more, here's the progress that you would make. The more your model can focus on the outcome, I think the more doors will open, because everyone has a sense of their problem. What they're choking on is the fastest way to get there fastest. And I think your model could potentially help that.
And don't forget, I feel like, and I'm going to date myself, that this evidence-based focus is relatively young still. And so the fact that you want to be part of that movement, absolutely. The other thing, as a government side, one of the first asks of the mayor was, can we be innovative? And I think where we are trying to be innovative is around the open technology. We have a whole division on open data source, open data source, and we have a whole, out of the executive office, we have a performance management that really looks at all the performance indicators as we go, because I think especially in government and big nonprofits, oftentimes we get criticized for just doing what we've always done. And so I think being focused on evidence-based decision making, focused on transparency and data is one way to pivot if you haven't done so before. So I actually think that's a great idea. Other questions? We had one more? Yeah.
We're gonna stick in here.
This is a little off topic, but Gerald, I noticed your title is Chief Diversity Officer and SVP, and I was just curious, what does Chief Diversity Officer mean at your organization?
So thank you for that question. If you think about the American Heart Association, American Stroke Association, we're probably three things. We're a science-driven organization. We have a tremendous brand, and we're driven by over 30 some odd million volunteers. And so when you think about the fact that we operate in over 60 countries, if you think about the fact that every community is different, when you think about the needs of a community, they change. And so you may know this, almost more than half of the Asian American population is in the Bay Area. When you think about education as another dimension of diversity, when you think about income as another dimension of diversity, my job is to make sure our organization is thinking about all dimensions of diversity when we think about our programs, our products, our services, our science, our advocacy agenda. So for example, when we think about these wonderful programs that we create, to what education level are we creating them? When we think about the fundraising programs, and we think about who are we talking to, and do we understand their wallets? The most read newspaper in the United States is the USA Today. It's written at a 6th grade reading level. And so when we think about our programs that are science-driven, how do we translate that into things that matter? When we think about our events, are they as inclusive as they can be? When we talk about operating in Asia and other places, do we know the difference between a handshake, a bow, and a hug? Because depending on what culture you go to, you can't shake someone's hand, you can't hug them, and you have to bow. And so helping our organization think about all of those things are critically important. And then when you think about marketing, you know, there's something to be said about total market approach, and then there's something to be said about market specific. And my job is to make sure that all of our people are thinking about those things before we push send or we push go or before we open our mouths.
And I would challenge you at this time and space that we are working to really redefine diversity. I was really shocked that in my executive position that diversity is really not the color of one's skin, but you know, I am responsible for the aging, you know, adults and children with disabilities, and so having an internship program for folks with severe disabilities, it just took a totally different dimension for me, because I think often we take a word like diversity as a status quo, right? And being an Asian, the highest cabinet member in the Mayor Bowser's administration as an American, Asian American, it's been fascinating to tackle that head on every day. So I would say the intentionality of definition and practice, how you see it through both your practice and your cultural expectations, I can't speak to how important that will be in the future.
Yeah. Awesome. Thank you very much. Let's put our hands together for the panelists. This was incredible. Thank you, all three of us, for joining us from out of town, and they'll be around for questions.